So my name is Julie Delahaye. I'm an occupational therapist and I work in Kent and Medway NHS and Social Care Trust. I'm going to present to you the Green Walking Project, what happened here. And I'll briefly talk to you about how I promoted the project, how the walk went, and finally, I have some very exciting new news hot off the press. So I'm based at Priority House in Maidstone. It's an acute mental health hospital, which comprises of 3 adult wards and an adult ward, or older persons ward. April last year, Chartwell Ward was chosen for the Green Walking Project. It's a female ward, primarily with a diagnosis of EUPD. And we chose this ward because research shows that women are less likely to exercise than men, and because it's a very challenging ward. So being part of the project across other sites in England allowed us, one, to offer support through difficult times. For us in Kent, some of the senior colleagues were quite negative initially. I think there was a fear that patients would go AWOL, but they never did. And one senior manager said, if they can walk, they can be discharged. Highlights rather a lot about bed management with us. But I had a very supportive manager and she helped motivate us to push through these negative vibes. The project participants also showed a variety of ideas on how to get started. For example, John from Cornwall, who you've just presented before me, kindly sent us his walking poster. And we loved his idea of a poster, developed it further, making our own poster and leaflets, which I've got here, and using the photos we took from our very own walk. We invited the physios, OTs, our chaplain and the OT students to support us in getting the walks going. We also set a Thursday afternoon, it's obviously the best day for a walk, and advertised this in the ward's therapy programme. It was important to allow time to talk to our ward colleagues to identify suitable patients. And we didn't just choose informal patients, we saw an opportunity to positively risk take with particular detained patients. An hour before the walk, staff were involved in gathering patients, checking section leave, very stressful, and making sure patients were dressed appropriately. In our experience, patients usually go out to Tesco's and have a smoke while they're out on leave. The Green Walk offered a healthier option for time out. The walk was an hour long, including a break halfway for refreshments. We took a picnic rug and water and sat down and enjoyed the view. Besides the usual benefits of walking, nature has its own power of healing. When you enter the woods, you stop. You're mesmerised by its beauty. The chatter in your head stops, the tension falls from the shoulders, and the breath takes on a more relaxed pace. The person behind the illness is revealed. We saw the patients as a person, and they saw us as people. It's because we spent more time with them in a more natural environment. And we soon realised that we looked forward to the walks ourselves, and this added to the staff's well-being too. And the more times we did the walk, the more confident we became, and the better it flowed. For example, during one walk, one of our patients experienced an epileptic seizure, and another patient helped us with the situation. He was a competent first aider, which was wonderful. We coped well, but we learnt a lot about planning future walks. For example, 1, have a buddy on the ward to phone for safety. 2, know your exact location. This might seem straightforward, but can appear to be difficult to describe when you're in a wood. We found an app, it's called What 3 Words. It precisely identifies your whereabouts in 3 unique words, anywhere in the world. And the emergency services know about this app and they can then pinpoint where you are very, very quickly. So like John, unfortunately, our green walks are put on hold at the moment because of the social distancing issues, because our wood walk is very narrow. So it's very difficult to do the 2 metres apart. But we really look forward to getting back to walking in the woods as soon as we can. So now I'm going to talk to you quickly about how we promoted the project. We wanted the green walk to go further than our site and to keep it going across Kent. So here's some tips. First of all, whenever we had visitors to our team, whether it be a student, the chief exec, or a visitor from another team, I'd always choose the Thursday for them to come and visit, so they could join us on the walk and experience the benefits for themselves. It's a winner every time. And the communications team manager came on one of these walks and loved the idea so much that she wrote an article about the Green Walking Project for our Trust's Connect staff magazine. The team also then employed a professional photographer who took beautiful photographs of the walk, which were then used in the posters and the leaflets that we use now. And we use this promotional material for recruitment, preceptorship days, as well as when we go to exhibitions at the county show, etc. It's just a really lovely way to engage with people. The communications team also put adverts out requesting donations for the walk, and we received some really lovely gifts of coats, a backpack, reusable plastic cups, bird books, etc. Wonderful. Last autumn, I presented the Green Walking Project to the Trust's Allied Health Professionals Annual Conference. I gave out the Green Walking starter packs and the leaflets and decorated the tables with flowers and fauna. It generated a great deal of interest from other sites in Kent and Sussex, and so far I'm aware all the wards in Maidstone and Canterbury are green, well, they were green walking up until now, plus the Dartford site too, and there may be even more, we don't know. The Trust volunteer team also have been very supportive for us. They've now recruited 2 volunteers for the walk. We found that our volunteers kept the group going every week because they turned up and expected to walk. The volunteer team also joined us for the annual RSPB Birdwatch Week, which we went walking with the patients and used our binoculars to count the birds.